Hi there. I'm Morris Bullock, and I'm Director of Physician Relations here at Southeastern Regional Medical Center. I'd like to take some time to give you a little bit of historical perspective about our hospital. Southeastern Regional Medical Center began in 1953. Prior to that, we had two previous existing hospitals. We had the Thompson Hospital, where I was born. We also had the Baker Sanatorium. Baker Sanatorium was founded by Dr. Horace Mitchell Baker Sr., who actually trained at Johns Hopkins and married a local girl. And during their courtship, a number of business people and local citizens encouraged him to come to Lumberton to establish a practice. We needed a good young surgeon. And in fact, they said, if you'll come, we'll help you establish your own hospital. And so the Baker Sanatorium came into existence. The other major hospital was the Thompson Hospital, where I was born, and Dr. Neil Archie Thompson founded that hospital back at the turn of the century. It existed on West 5th Street for a number of years and tragically burned down, was rebuilt on 6th Street and coexisted a few blocks apart from the Baker Sanatorium for about the next 50 years. In 1953, after the Hill-Burton money became available through the Hill-Burton Act, local citizens and business leaders decided, along with both hospitals, we needed a good new hospital and only one hospital to serve all the needs. So Robson Memorial Hospital was founded in mid-August of 1953. Our first CEO was this gentleman, Mr. Jim Devon. Mr. Devon came to us from Sampson County, where he was an administrator of the hospital there. He gave us 25 years of his life, and his challenge was he actually came on board 1 year before the hospital opened. We bought about 7 or 8 acres of land in the northern part of Lumberton, and we established the hospital there. Initially, it was about 120 beds. And he came on board to help oversee the construction and to mold together the two cultures of the Baker Hospital employees as well as the Thompson Hospital employees. That was quite a challenge. Again, he gave us 25 years of his life. He was well thought of by his peers. He was elected to the board of the North Carolina Hospital Association and later served as chairman of that group. He then hired our second CEO. We've only had 4, and this is Mr. Don Hiscott. Don is originally from Toronto, Canada, and came to our hospital, was hired by Mr. Devon to really be the chief number cruncher. He was the chief financial officer, and he was really groomed to become his successor. He gave the organization 30 years of his life, the last 19 of which were spent as CEO. He too was elected to the board of the North Carolina Hospital Association and later served as chair. He was very focused on population health coming from Canada, and really wanted to focus on things outside of critical care, acute care medicine, and focused on things like home health and DME and hospice services. In fact, also focused on our fitness center, which was the first hospital-owned fitness center to open in North Carolina. And that's been almost 30 years ago. Mr. Hiscott then handed the baton over to this gentleman, J. Lucky Welch, given the name Lucky, a pharmacist by training. In fact, it was Mr. Devon who actually hired Mr. Welch. He is originally from St. Paul's and came here early in his career and managed our pharmacy and other departments, I think materials management, purchasing, some others. Then being tapped by Mr. Hiscott to come in and work in an administrative capacity and became our chief operating officer and vice president. And he pretty much then ran the hospital to allow Mr. Hiscott to do the other things that he needed to do. Mr. Welch gave us about 37 years of his life, and yes, he too was asked to serve on the board of the North Carolina Hospital Association and served as chair. Then our current CEO is Joanne Anderson, who came to us from Pikeville, Kentucky. It's ironic that just this past February, Joanne was actually sworn in as the chair of the North Carolina Hospital Association after being on its board for the last several years. Joanne is in her 9th year, so 63 years of service and really only 4 CEOs, and every single one of them actually served as the chair of the Hospital Association. That's really quite an honor. We continue our tour, and I'm actually in the hallway of from the bed tower lobby leading to the main hospital. There are a number of portraits that you'll see. Each of these portraits recognize a healthcare professional, a physician who've given lifelong service to our organization. This is actually a portrait of Dr. Horace Mitchell Baker Sr. The dates read 1887 to 1945. But he actually founded the Baker Hospital, also founded the Baker School of Nursing. He realized early on you can't have a hospital without nurses. Ironically, that nursing school moved to this campus, as you'll see in an aerial photograph. And eventually the community college system actually absorbed that associate degree nursing program, so it still lives in perpetuity. The other portrait I would point out is that of Dr. Neil Archie Thompson. And as I mentioned, Dr. Thompson founded the obstetrics and pediatric hospital, known as the Thompson Hospital, where I was born. The dates read 1873 through 1923. So again, this goes back quite a ways. We think this is a monocle, we're not sure. But nonetheless, both gave wonderful service to our local community. We've traveled a little further down the hall and you'll see a number of portraits that include our current Board of Trustee members as well as our current CEO, Joanne Anderson. And current chair is Bo Stone, farmer down in the Roland community, and all our current board members, which include a number of medical staff members. Dr. Joe Roberts is on our board, as well as our current chair of our medical staff is Dr. Terry Lowry, who happens to be my neighbor across the street. And ironically, the current chancellor at the University of North Carolina at Pembroke, Robin Cummings, is a cardiothoracic surgeon. So we welcome having those persons on our board. They serve at their own pleasure on a volunteer basis, and we are appreciative of their knowledge of our community we serve and helping us to develop strategic plans and execute them to serve the needs of our medical community. We're fortunate to have captured a number of aerial photos that kind of help tell the history of the hospital. These are two pictures of the old Baker Sanatorium facility that still stands today. It's Baker House Apartments now, and the building was refurbished through a grant through the city several decades ago, and I know Dr. Baker Jr., who was also a general surgeon that followed in the footsteps of his dad, was with me when that building was rededicated. I was the chamber president at the time, to know that it continues to serve a very useful purpose in assisted living. This is a picture of the old Thompson Hospital where I was born, and later that building served as a library and then eventually became the City Hall. A new City Hall was built. They needed to expand the parking lot, and so the building was unfortunately torn down and really could not be salvaged. Moving from these two pictures, we moved to one of the very first pictures of Robinson Memorial Hospital back in August of '53. This is an aerial photo shot that was captured in the local newspaper, the Robinsonian. You can see kind of a Y configuration, the main hospital, again about 120 beds. This was a nursing dormitory and some classrooms that the nursing school moved to. And the only other building was the boiler that helped keep the buildings warm during the wintertime. It was located at the north end of town, right off West 27th Street, Roland Avenue, West 29th, and Tabarker Street. The next picture is 4 years later, and this picture was actually taken by Jim Devon, who was an avid flyer, had an airplane, as did Mr. Hiscott, so we've salvaged those pictures. This is a black and white picture, and you can see already we've added a wing to the original 120-bed facility. Better yet, you can see how rural the countryside was around us. You see standing timber, you see farmland. What you don't see is I-95, which eventually will be located over in this area. The boiler room now has a laundry beside it in addition to the additional wing, so now we're probably around 200 beds, give or take a few. But a broad campus. Another thing I would point out is you see some cleared land just across the street near Roland Avenue and West 29th, and that was the land being cleared for what eventually becomes Tanglewood Elementary School, which will show up in the next photo. So that was in 1957. 4 years later still, the Y configuration now becomes a W configuration in red brick. Tanglewood School now is a reality, and with that Tanglewood Elementary School, you begin to see some residential homes pop up all around. We actually added central air conditioning. You see a cooling tower here, and so the whole main building was retrofitted to be centrally air conditioned. Prior to that, it really just had pockets of air conditioning here and there. We still had 2 stands of trees and plenty of room to grow. And we had really, if you notice, no main lobby. It was kind of a step-up vestibule, 2 sets of doors, and that put you right there in front of the switchboard, and behind that were the elevators. And then moving on from 1961, some 3 years after that picture was taken, I-95 was completed. This picture is actually in 1967. So this was about 4 years after I-95 opened. You can see a tremendous measure of growth, the north end of Lumberton. And it's over in this area you see what is now exit number 20, where Highway 211 or Roberts Avenue and I-95 create a junction. For the hospital campus, we pushed down some of those trees in that, I guess, northeastern corner and built what we call the East Building. It's a 3-story building. The first 2 floors were dedicated to skilled nursing beds. What is now Woodhaven was initially in that building. The 3rd floor was and is still now a psych unit that serves a 4-county region. We had some administrative offices for some time there right beside it. And eventually we built Woodhaven on a separate campus and took those beds away and then used those as private beds here in the hospital. So that was a little bit of history. We still have a stand of trees over here. Another thing that happened between these 2 legs of the W, the emergency room expanded from a 4-bed unit to a 7-bed unit. So that was substantial. Moving on down, next picture is in 1977. This is a 10-year span. We pushed down the remaining trees over in this particular corner near West 27th and Roland to make additional parking. So now both parking lots kind of feed into the main entrance. We have added a lobby to the main hospital, which included space for a chaplain, snack shop, a gift shop, as well as just a lot more room for people to come and go and to wait. We were actually the first hospital to hire a chaplain. Mr. Devon got a grant. Can't imagine a hospital not having a chaplain, and we've been blessed to have some great ones. So this was in '77. Then moving forward in 1979, this picture is a little blurred, but it's because Mr. Hiscott took this picture. He also had an airplane and loved to fly. And he took the picture while he was flying the plane. And you notice this storage building, 4 floors, has a connector on the 2nd floor. This allowed us to go to an exchange cart system. And instead of occupying weeks and weeks or months of linens and supplies, it allowed us to go to an exchange cart system and every 8 hours bring in new supplies and equipment. We still needed to grow, and we bought another block of city land that adjoined our property, and that allowed us in this parking lot that exists now to build what we call the Diagnostic and Treatment Facility. So big plans were made. We actually had to move some of the homes that existed on this additional block where our parking deck now stands. Some of the buildings, the homes, were converted into doctor's offices that existed. This was in '79. Then the next picture is actually taken in 1985. This is black and white film that Mr. Hiscott had in the camera that day. You can see this white brick area that's been added to the yellow and the red scratch brick. And now we've transformed the hospital. We have a new front door, and right across the street was the beginnings of our parking deck. There were 2 levels, a ground floor and one above it, but like an erector set, you could go up 2 additional floors in the future. The Diagnostic and Treatment Facility was around 67,000 square feet, and it afforded us a brand new laboratory on the front corner and then a medical imaging area. Above that was an ICU, 12-bed ICU, a 7-bed intermediate care area. And then to the rear of that was a brand new emergency room that's now 19 beds. Eventually we added on a cath lab on top of the emergency room. And that occurred in the early 1990s, 1991. Our medical staff felt the need that we could better serve our community with a diagnostic cath lab and save lives. And so we partnered with Duke. That was before Duke ever had any outreach programs. But because Dr. Baker Jr. had actually trained at Duke and a number of physicians here had close relationships there, we did establish a bond with Duke, and they helped us establish a cath lab, create a fiber optic feed so that they could actually see the caths we were doing live in real time. And it was a bright day for our hospital. The next thing that I can point out is the parking deck was fully completed in 1995, up to 4 floors. We've added the cath lab here above the emergency room. We also added in the early 1990s, an outpatient surgery center. Previously, we had 8 operating rooms, all in an inpatient setting. That was on the second floor in the main scratch brick building. 4 of those operating rooms were moved to the front corner of the hospital so that we could more expeditiously serve same-day surgery and easy outpatient surgery persons. You also see a mobile MRI parked here. We had that mobile MRI for about 7 or 8 years before we actually accrued enough volume to warrant having an in-house MRI unit. We now have 2 units, probably knocking on the door for a third in terms of the volumes that we're doing. That was in 1993. And then moving forward, the next aerial photo signifies the actual diagnostic and treatment center expansion. We added an additional 3 endoscopy suites here to the main outpatient surgery area. And underneath that, the lab almost doubled in volume. But the parking deck is now maxed out, and we still had a physician's parking lot over here to the left. That's about to go away because of the expansion needed in the medical imaging area. Also, in a short period of time, you see these homes that were converted to doctor's offices. I think there are about 4 of them. The parking deck would no longer be sufficient. We have need to actually tear those down and create an L-shaped parking lot because, again, the parking deck would not be able to contain our capacity. We next moved to the year 2001. You can actually see that the L-shaped parking lot has now been established. This building has moved forward to overtake where the physician's parking lot used to exist. That was moved to the first level of the parking deck. And it's now time to expand the emergency room. So you see it's actually under construction at the time. The 19-bed unit had grown to 23. It will now grow to 45. That's the current capacity. The only place to stage that construction was in the parking lot, so we had to create a temporary parking lot for about a year. And so after 50 years of people pulling in that parking lot, they were redirected to park over here instead. After a year, that chaos ended, and we got a brand new addition to the emergency room. The next picture goes down to show the new bed tower in 2003. And this construction coincided the completion of it at our 50th anniversary in August of 2003. We needed new bedroom space, and so we appealed to the state to replace those beds with a new building. We had to situate it between the current parking deck and where the diagnostic and treatment facility exists. There used to be a road that actually ran through there, but the city allowed us to actually purchase that land and to shoe spoon that building in there, and that gave us all private rooms. That was a 6-story structure. The foundation allows for 8 floors. We could go up 2 additional floors. You can also see the addition to the emergency room that's outlined here. As I move it across the previous emergency room was over to the left, so we added this additional space. And over here we have kind of a teardrop driveway leading to the bed tower lobby itself. The next thing we wanted to focus on was an open heart surgery unit, and we wanted to build that on the top of what would be the 3rd floor of the diagnostic and treatment facility, and that took a big fight. We had plenty of heart disease. In fact, we had more heart disease per capita than any other county of the state of North Carolina, and yet we had competition to the north of us. Fayetteville, Cape Fear Valley had a heart center, as did First Health over in Pinehurst. Wilmington over on the coast, New Hanover had a heart center, as does McLeod down in Florence. And so when we first began to appeal for an open heart surgery unit, there weren't but about 21 other open heart surgery units in the state. And there were only 18 counties, I think, that out of 100 that would actually serve cardiac surgery. And so we got a lot of pushback, and everybody said, well, just send it to us. You don't have to create your own open heart unit. You can just, we're on the way. No matter what way you're traveling, we're on the way. And so we appealed to Duke, and Duke said, you're right. Patients shouldn't be transported to us. Duke needs to come to Lumberton, so we'll be glad to gift to you an operating room and a heart-lung machine and whatever you need. Try to make that move. And we went to the State Health Coordinating Council to ask permission to do that, and they said, no, we cannot allow that. You can't horse trade major services like that. You have to actually show need. eventually Wilmington, Bill Axelson was the CEO at the time, and he finally saw the light and said, you know, you're right, we don't do that much heart disease from your area. You deserve the right to do so. Florence pretty much had the same thoughts. But these two hospitals to the north and northwest of us were very adamant that we did not deserve open heart surgery. And so they fought us bitterly. And they already had Duke in their front yard. They didn't want Duke in their backyard as well. So that was a 4 or 5 year fight. And Mr. Welch forged through with that, and we finally kind of took a backdoor approach to, we appealed to the state health plan that the governor would have to oversee and sign, and we took busloads of patients to various public meetings to argue our case, and we had good evidence behind it, and eventually they saw fit to approve our open heart surgery unit, and that would open in around 2006. The next and the final photo I can show you is in fact the heart center you see in the glassed area on what is the third floor of the diagnostic and treatment area. And then you see also, if you count, that there's now a 7th floor that's been added to the bed tower. It can go up to 8. We were able to complete the elevator shaft so that that's not going to be necessary in the future. But the state's very careful in what they regulate and how they allow you to build resources. But the heart center actually opened. We were able to recruit a cardiothoracic surgeon, and we've added 4 interventional cardiologists. We've just now received word of a second CV surgeon that'll be coming later on this year. And also the state in its wisdom revised their bed count formula need. And within a year or two after the heart center actually opened, they saw fit to allow, there were 9 hospitals out of 100, 9 counties out of 100 counties that were allocated additional beds. We were allocated 37 additional beds, and that allowed us to add a 7th floor on the bed tower. And that allowed for additional capacity for the additional patients that we would serve. You can see we've come a long way. One other thing I would mention is that we have a medical mall where the Winn-Dixie food chain used to exist. We leased about 45,000 square feet. That's just out of the realm of this picture. And we lease about, I guess, 12,000 square feet or so to Duke. And we occupy the remainder of that because we were pretty much landlocked where you see. We have added now the Southeastern Health Building, Southeastern Health Park. That's near exit 22. And we now own about 25 or 27 acres out there. And so we have a new outpatient surgery center that now has 4 operating rooms and some endoscopy suites. And we're proud of that and anxious to backfill some space here with new inpatient surgery areas eventually. But that's kind of the story of the hospital. We've come a long way in a short time. You don't know where you're going unless you know where you come. And you can see from these pictures we've come an awful long way. So we stand to continue to serve our local community and do the very best that we can. I want to thank you for your time. It's been a wonderful historical movement over the years to see the growth of the hospital that's here to serve the needs of the medical community. Thank you.